Hi and welcome. I'm trying to learn medicine today. Achalasia of the Cardia, and after we've done that, we're gonna do leg injury prevention training. And if you participate in the leg injury prevention training, then it's better to ask. Achalasia of the Cardia. That is, yes, and we're talking about diseases, and it's the disease of the esophagus. The achalasia of the Cardia, that is a rare disease, and you probably get it already. I'm learning. I'm not teaching. A rare disease, I never heard of it a few seconds ago. A rare disease in which the muscles of the esophagus, got it, fail to work properly. Okay, the esophagus is here, that goes from the mouth to the... No, I'm actually not sure anymore. It is the thing here. One of the two things here. Yes, and it's the thing for food. Normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. Okay, normally the food comes from the esophagus down to the stomach, and there is muscle movement, and that does it. Peristalsis movement must be, but I'm not really sure. So normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter, that is the muscle ring at the lower end of the esophagus, relaxes and lets the food through. Okay, at the end of the esophagus there is the sphincter. It relaxes and so the food can pass through. In achalasia, that's the disease here, or the problem. In achalasia, the esophageal muscles and sphincter do not respond to a swallow. Okay, and the food and saliva are retained in the esophagus, which becomes swollen. Okay, so the person swallows, the food comes into the top of the esophagus, but when the peristalsis movement is not started, the food is not pushed down, and also the sphincter at the end of the esophagus is not relaxing, and the food gets more or less stasis in the esophagus. And the food and the saliva, that is the water from the mouth. The saliva, I think, are retained in the esophagus, which becomes swollen, and then the esophagus swells. The symptoms are difficult in swallowing both of liquids and of solids. Initially intermittent, later continuous. Okay, just the swallowing of foods and also of liquids of drinking is a problem there. First only from time to time, and then more often. Food is felt to stick behind the breastbone. I don't know where the breastbone is. It must be. Okay, it feels like that the food is sticking somewhere here. But I don't know where the breastbone is. But I guess here. Chest pain does then come, and that can range from mild to severe pain. Okay, the people who have achalasia of the cardia, they have problems to swallow food and liquids and drinking, and it feels like food gets stuck. And also do they have chest pain, which can be mild but also severe. Regurgitation of undigested food and salvia. Regurgitation. That sounds a bit like vomiting it, but I don't know what regurgitation is. So we're taking from it, but we have to know the word regurgitation. I think it is vomiting it, but whether it is regurgitation of undigested food and saliva. And then also food and saliva may be breathed into the lungs, especially when the patient is lying in bed. This causes cawing, breathlessness, and chest infections. Okay, the food is more or less stuck in the esophagus, and if a person breathes it in, the food can come into the lungs, and that can cause cawing, breathlessness, or sort of problem with breathing, and also infections of the chest. The causes are not known. Achalasia of the cardia, not known. Complications are pneumonia and bronchiectasis. Pneumonia is an infection of the lungs, and bronchiectasis, that is when a problem of the bronchus layer inside of the lungs. So it's both lungs and bronchus problems. And also higher incidence than normal of esophageal cancer. That's the cancer that is the esophagus. Okay, the problem is that the food swallowed gets not but the swallowing does not make the reflex of... No, what is it now? They do not respond to the swallowing. Okay, it is swallowed, but the peristalsis movement does not push the food through the esophagus down, and the sphincter at the end of the muscle-ringing sphincter at the end of the esophagus doesn't relax and doesn't let the food through. It feels as if the food gets stuck behind the breastbone, might be to severe pain. It can cause regurgitation of the undigested food. It can be then breathed into the lungs and cause recurring breathlessness and chest infections. The cause of why it all happens is not known. Maybe it is, I don't know, for the focus, maybe it's a big one, not now. And now the complications are then pneumonia and bronchitis are problems at the lungs and at the bronchus, and also then a higher chance to get cancer at the esophagus. Treatment in home. Eat small meals sitting up. Okay, to eat only a little amount always, and that by sitting in a seated position. To take frequent drinks in small quantities, and always to drink just small amounts of water or whatever. When to consult the doctor? If any of the above symptoms persist for longer than a week, okay, if these symptoms of breastfeeding, I think we should go over there, but if these symptoms listed here a moment ago, then you should consult a doctor if it takes longer than a week, but again, yeah, this is not medical advice, I'm just reading what's in here. What the doctor may do, check to exclude more serious causes of symptoms. Okay, the doctor is checking if you have something more serious. Send the patient to a consultant surgeon who may order tests including barium, swallow, X-ray, and internal examination with an endoscope. I have to read it again. Send the patient to a consultant surgeon, so you get sent to someone else who knows it better, who may order tests including barium, swallow, X-rays. So I think that is you swallow the barium, and that I don't know really, but I think that is the thing where you swallow something, the barium, and that causes then that the X-ray can see that the barium is on your body, and then they can see what happens in your esophagus. I don't know. They're doing X-rays and internal examination with an endoscope, some way where they're coming with a telescope, with a microscope, just inside of the body. But it's an instrument, we explain it, an instrument with a light which can be passed down the throat into the esophagus. Maybe you've seen the movie War Worlds 2005 by Steven Spielberg. So basically, I don't know what to spread now. So it's a thing, it is an instrument with light which can be passed down the throat into the esophagus. I don't know if it is less disturbing as what I wanted to tell, but it's not so funny. Treatment may require an operation to cut or stretch the muscles at the lower esophagus sphincter, S-P-H-I-N-C-T-E-R, sphincter, in order to allow food to pass into the stomach. Okay, it is cut or stretch the muscles at the lower esophagus sphincter in order to allow food to pass into the stomach. Okay, surgery. Prevention, none is possible, but I think that has to do with we don't know what the cause of it is. If you find the cause, maybe we can do something to prevent it. The outlook, reasonable good with treatment. So if treatment happens, then the outlook is quite good. Now, before I go on, we are done with the medical part. If you were here for medical part and the achalasia of the cardia, I don't know where we get the words from, achalasia of the cardia. I don't know where the cardia is, and I don't know what achalasia is. So achalasia of the cardia. If you were here for that, you can go directly to the next part where we will talk about something else. Maybe Achilles tendon rupture. If you stay here, we're going to do the leg injury prevention change, so that no one gets an Achilles tendon rupture. But if you participate, it's at your own risk. So if you get an Achilles tendon rupture, it's at your own risk. Now we're starting with a little warm up. We're bringing one leg up and we're pointing the foot down. And we're taking the leg at the ankle and we're making a straight back and we're pointing with the knee down to the floor. And we're taking the other leg, bringing the knee up, putting the foot down. And we'll take the leg at the ankle and we're making a straight back and we're pointing with the foot down, with the knee down to the floor. And now we're doing the next exercise. So we are bringing one leg up to the right angle, even line hips, tall off the back, and get arms sticking out. And we're turning us slowly to one side and try to keep the balance and try to keep steady. If it doesn't work out, just try it again. And now slowly over to the other side. back into the middle, and with the other leg. Leg up, and now try to do the same. And over to the other side. Our next exercise, one knee up, breathing in. Out the leg to the side, breathing in. Out into the middle and down. Again, the leg up, breathe in. Out to the side, again in. Out into the middle and down. The other leg up, breathe in. Out to the side, breathe again in. Out into the middle, down, and again the leg up. Out to the side, breathe again in. Out into the middle, and down. And now, we're bringing the knee up, and we're pressing with the inside against the knee. Right angle with the leg, flex foot, even line hips, hold with the back, little bend in the elbow. And the other knee up. Right angle with the leg, flex foot, even line hips, hold with the back, and we're pressing from the inside against the knee. And the last exercise, knee up, and knee presses up and to the side, up, to the side. And the other knee. Now just ending, legs wide apart, breathing in. Out. Okay. Out. And the last one, in. Out. We're going to close the legs. And out. That was the leg energy training. I thank you very much, and next.